So just a quick exercise for your lower back, which personally I will do after McGill's Big Three. This will involve using an elastic TheraBand that you will just knot. And ideally what you want to do is find a door handle in your house that's approximately the height of your waist, and just latch it onto there. You're going to step one foot in front of the other, so split your stance. You can keep your knees straight. All we want to happen is that your pelvis is going to be slightly rotated and slightly locked out in that position. You're then going to take flat hands together inside of your elastic band and lock your elbows firmly into your waist. You're then just going to take the tension up on the band, pulling into a rotation to whichever side. And you can start off in the first week, if you've got a painful back, just by holding for 10 to 15 seconds and then releasing and coming back. If you want to increase the tension at a later date, you can just step across a little bit so that by the time you're pulling into neutral, you've got quite a bit of tension on the band, and then you can start to push just beyond. So you can hold statically or isometrically, as we say, or you can do some small rotations. Now this is very isolating for your lumbar segments, so we're looking to exercise only your lumbar spine, and we don't really have much more than 5 degrees of movement available at the lumbar spine when it's isolated like that. So this is not a big movement, you only have to go through a very small rotation, and you can do sort of 10 to 30 reps if you want to, if you're just doing the repetitive rotations, and then you're going to swap like so. Okay, and I personally always do things in threes, so I'll do 20 in one direction, 20 in the other direction. But when I first started doing this exercise during a very bad lower back flare-up, I was literally just holding for 10 seconds, and that was sufficient to start getting me out of danger. As a matter of routine these days, I do my McGill's Big Three on the floor, I do my rotations, and then I go into further rehab exercises. Okay, don't do anything that is painful. It should be relatively pain-free. Even when you're in flare-up, it should be totally manageable to hold a degree of tension on the band. If it's not, you're still too acute, just back off and come back to it the next day perhaps. When you have a lower back dysfunction, the muscles either side of your spine can weaken and shrink very, very quickly. This is a way of getting some strength or maintaining some strength and activation in those muscles, and not letting them go down that negative trajectory. Okay, see how you go with that.